This is Alore News.
Oyo State Ministry of Information, Culture and Tourism, in collaboration with the United Nations Children's Fund, Unicef, held a 3-day advocacy conference on Covax Uptake and materials development for communication stakeholders. The stakeholders advocacy meeting of participating states, including Oyo, Ondo, Ogun, Osun, Ekiti, Lagos and Edo states, held in Oyo Town, Oyo State, had in attendance commissioners, permanent secretaries, directors and program officers of the 7 states ministries of information under the jurisdiction of Lagos and Akure UNICEF field offices. Appreciating UNICEF for its commitment in promoting the quality of lives of children and women over the years, the Oyo State Commissioner for Information, Culture and Tourism, Dr. Wasiu Olatunbosun, in his welcome address, expressed his satisfaction on the improvements being witnessed in the radio drama series Facts for Life, heard across various radio stations in Oyo State.
At the commencement of hearing the FFL programs in Oyo State, only 19 radio stations were involved. However, after our last meeting in Akure, which called for increase in the number of radio stations that air the radio drama series, the number had risen to 24 stations. It is germane to state that since assumption of office by the governor, Seyi Makinde-led administration, we had regularly ensured that issues relating with the existence of humanity are not taken with levity. The administration's focus on primary health care at world level that had witnessed the renovation and the equipping of over 280 primary health care centers remain unequal in the annals of our dear state.
Expressing her satisfaction on the sustenance of the UNICEF and state government collaboration Facts for Life radio programs across the participating states, the officer in charge, UNICEF Akure office, Mrs. Ada Eziogu, urged every state to remain committed to quality and up-to-date health information dissemination across the nook and cranny of their states.
We are glad to hear and to acknowledge that the states have understood that whatever we are doing is for the majority of our people. Many of us here have information. Many of us are saddled with the responsibility of passing information to the majority of the population. That is our key assignment, key role, and that is one of the reasons we are seated here. UNICEF is supporting the state to deliver on their mandates. So just a reminder, we are willing and we are partners that you can trust and depend on to be there for you when it comes to programs on women and children.
Acknowledging the significance of the meeting in their goodwill messages, the commissioners from participating states appreciated UNICEF for its steadfastness in promoting societal health.
For us, health is wealth. And we would like to improve the indices of health so we can witness growth and development. I'm happy to say our state-owned FM station pioneered the airing of the 52 episodes of Facts for Life program in its own. I would also like to state that Ondo State is the first to start the airing of the drama in its own.
First, congratulate UNICEF for this program, for this initiative, because the program initiative has impacted largely on the healthcare delivery system in Ondo State. We've been able to domesticate virtually every agreement with here in Ondo State, such that we now have radio stations scrambling to be part of our success story.
Representatives of other leadership of various information ministries also shed light on the roles their state governments have played in promoting mother and child health.
The world has not fully recovered since 2019 when coronavirus came into existence. Though the situation is no longer tense, there is need to still talk about it to avoid further outbreak as there are scary incidences being recorded. Edo State government has not rested on the issue of mitigating COVID-19.
You will agree with me that Lagos State occupies a very unique position as the melting pot of Nigeria As such, they need to review Covax uptake and ensure periodic development of materials to enhance the effectiveness of our public enlightenment campaign in order to promote child maternal health and the vaccination of our citizens against COVID is very important to the Lagos State Ministry of Information and Strategy.
Expressing his view on the partnership between UNICEF and the state government, the Permanent Secretary of Oyo State Ministry of Information, Culture and Tourism, Mr. Oyeshola Oyedele, said more work still needs to be done.
In Oyo State, if you see, the healthcare system has been greatly enhanced. His Excellency Engineer Seyi Makinde promised to deliver one primary healthcare center for each ward, and he has gone more than 80% of the wards in the state having the primary healthcare center. The essence of that is for anybody to access basic healthcare. You don't have to travel, you don't have to go long, and it is already happening. It's not only building, equipped primary healthcare center. So the state government is already keying into the basic concepts of this program by UNICEF. The only thing that one would wish is that there should be expansion, more collaborative efforts. UNICEF should come up with the meeting. It should not be too far apart, like after 2 years. The meeting should be something that is like more regular, and the new things coming up, the new ideas should be integrated.
The gathering was also used to encourage UNICEF to intensify efforts on the peculiarity of every community in promoting information dissemination. Gbenga Adesui, reporting for Alore News.